Nicole, and I'm going to be doing an informative speech on schizophrenia. Because after I graduate from nursing school, I want to be a psychiatric nurse, and schizophrenics really interest me a lot. So you are a young woman sitting in a park by yourself, listening to your iPod all by yourself, just minding your own business, until a random guy approaches you, asking you to take out your earpieces because the government has tapped into them and can read your mind. He believes that because the government can read your mind, they know you're talking to this man, and he knows that you're talking to him, and the government knows his exact whereabouts and are after him now. You think to yourself, is this man crazy, or what is going on with him? The truth is, he's not crazy. He actually is struggling from a mental disease called schizophrenia. Today, I will talk about what schizophrenia is, misconceptions, causes of it, signs and symptoms, and some interventions and medications that the nurse can do to help treat the symptoms of it. So let's get started by talking about what schizophrenia is. According to the Psychiatric Mental Health Nursing textbook, the definition is, it is a disturbance in thinking, feeling, and social relations. Schizophrenics are also affected in two negative ways. One of them is that they have a severe brain disease, and also they are isolated and discriminated against in our society. And then also, according to the World Health Organization website, many people have misconceptions about what schizophrenia is. And there are four very common ones that people believe. And one of them is all people with schizophrenia are violent. That's not true, because they are not any more violent than the typical man or woman. The only reason they may become more violent is if they're not taking their prescribed medications appropriately, or using drugs and alcohol excessively, abusing it, and if they have a history of violence. Other than that, they're not any more violent to society. In fact, they're more afraid of you than you are afraid of them. So, another misconception is that it is the same as split personality. Again, not true. The definition of split personality is that there's two personalities within one personality, whereas schizophrenia, there's just one. Actually, the word schizophrenia is derived from a Greek word that means split in reality. So that means that they have a hard time grasping what is real and what is imaginary. So that's completely different than a split personality. Another one is dysfunctional families cause schizophrenia. There has been no connection between dysfunctional families and schizophrenia. Actually, if there's more stress or if the household is unstable, it can cause the patient to relapse, but is not a direct cause of schizophrenia. And then lastly, that there is no hope of recovery. Although there is no cure for schizophrenia, there are ways to help control the signs and symptoms by using medications and things like that. Now that we know the definition of schizophrenia and some misconceptions people have about it, let's talk about some causes of it. Although the cause is not fully known, but it could be a result of genetics or environmental. And some examples of genetics is that it is a strong hereditary component, and meaning that if you have a parent or a sibling or anyone from the family that has it, you have a 10% chance of developing it as well. But it's important to remember that genetics only influence it. It is not determined. It is not determined by it. So that means just because someone in your family has it, you're not going to get it 100%. It's just a possibility you can get it. And then environmental causes. Some examples, it could be high levels of stress during pregnancy lead to trigger schizophrenia by increasing the body's production of the hormone cortisol. Some environmental factors you want to be aware of are prenatal exposure to viral infection, low oxygen levels during birth, exposure to a virus during infancy, and early parental loss or separation, physical or sexual abuse in childhood. So if you're a nurse and the psychiatric unit at a hospital, a patient comes in, and it's really important to get a really thorough family history. Doesn't mean that they had a history of family or physical abuse to help them get a more accurate diagnosis or determine the cause of schizophrenia. And now that we know some causes, let's talk about some signs and symptoms to look for in a patient. Signs and symptoms are divided up into two separate categories of positive and negative symptoms. And the positive symptoms are, they appear to reflect an excess or distortion of normal functions, and some of those are delusions, and that is a fixed false belief. So if you hear them saying that they're God or the president, that's considered a delusion. Another one is hallucination, where they can have either a visual or auditory hallucination. The most common is auditory, and that's when they think they hear the voices telling them to do things. Another one is disorganized speech and behavior. An example of disorganized speech is they cannot form a logical sentence. They can tell you that they want to take a car, but the airplane took all the traffic. As an example, they just doesn't form a complete logical sentence. And then, on the other hand, the negative symptoms appear to reflect or decrease a lot of normal functions. And some examples of those is a flat affect, meaning they show no emotions at all. And they have a lack of initiation of goal-directed behavior, meaning that they can't set a goal and reach it. They're just completely unmotivated to do so. And then another one is they are socially isolated. And now that we know the signs and symptoms, let's talk about ways that a nurse can help treat or control these signs and symptoms. One of them is to reinforce reality through reality orientation. Another one is accept patients' hallucinations as real to him. At the same time, you neither want to agree with the patient nor try to convince them that their hallucinations aren't real. You want to assume that the patient hears the voices because they could be a likely source of anxiety or fear. And you also want to avoid overwhelming the patient with too much talk. So you want to provide as much extra space as possible, especially if they're suspicious. And then a big one to remember is you want to elicit family support. You don't want to blame the parents for causing schizophrenia because they're not the cause of this disorder. Then you can also use medications to help control the signs and symptoms. And those are also divided into two separate categories of first generation, which are called the typical agents, and the second generation, which are the atypical agents. The first generation, some examples are Haldol and Prolixin, and those help block the dopamine at the receptor sites. And those work mainly on just the positive symptoms, whereas the second generation drugs, as like Clozaril, Risperdal, Abilify, for example, work on both the positive and negative symptoms. So those are used much, they're more common to use. And those work on blocking the dopamine and serotonin receptor sites. So today, you learned about schizophrenia. I told you what the definition is, the misconceptions about it, signs and symptoms and causes, and some interventions and medications to use. So next time you hear a person talking to himself or can't grasp reality, don't think that he's crazy. He's actually suffering from a very severe mental disorder. Thank you.